The CDC released new guidelines for going back to work as the coronavirus death toll here in the U.S. tragically passed the 100,000 mark. Internal medicine physician and MSNBC medical contributor Dr. Lipi Roy joining me now. Dr. Roy, wonderful to see you. Some of the things in the guidelines: masks, no handshakes, improved ventilation, temperature checks. But is it too soon to be talking about going back to work, especially with that grim milestone that we hit in the U.S. yesterday?
Hey, Allison, always good to be with you. Yeah, so this is a really solemn day and solemn moment to reach a landmark of 100,000 men, women, and some children who have lost their lives from a disease by this point, which is really, initially it was the virus, but now I feel it's just poor policy, lack of implementation of public health measures, which you pointed out. The CDC it's continually revising its guidelines, and for good reason. We're constantly gathering more data and then applying it. We're doing research nonstop around the world to understand how this novel virus is impacting us and what we can do in terms of public health, preventive health measures to reduce the transmission of the virus. Because again, that's all we've got right now. We have no cure, no treatment, no vaccine. But these public health measures can really work. And as you pointed out there in the graph, in the slide, the masks, the no handshaking, the temperature checks. Again, I think collectively, if we do this, and if companies, businesses do this, it'll keep not only the employees but the customers safe as well.
Dr. Roy, when we all eventually do return to work, it may be a long way off for some of us, but when we do get back to work, what other things do we need to be thinking about beyond these guidelines?
Yeah, I think that's a great question, because a lot of us work in environments where we're interacting with other people. Many of us, I know myself included, and many of my friends and colleagues, we're fairly social by nature, but we also work in environments where we need to interact with other people. I think you've heard this expression. I know you've used it as I have. The new normal. It's going to look. Right. It's going to mean maybe less interaction, no handshakes, no hugging, no high fives. It sounds so counterintuitive to who we are as human beings, but I think for now, that's what we're gonna have to do. Even little things like no shared candy jars, the water fountains, areas where we normally socialize. I think we're gonna have to maintain physical distance. We're gonna have to maintain maybe wearing a mask. It's all gonna depend on where we are in terms of the virus and the community spread of this virus.
Yeah. Dr. Roy, according to two new studies, asymptomatic COVID-19 cases may be more common than we had originally thought. Could you tell us a little bit more about that? And is that surprising to you?
Yeah, so, but if you think about it, Allison, people like Dr. Fauci and Dr. Birx, they've been talking about asymptomatic spread now for a couple of months. So we know that it exists, but it's great to see even more studies coming out showing the true scope of this asymptomatic spread. Again, this is a major reason why we're seeing this virus spread as much as it is, as consistently as it is. So there was one study in Wuhan, China, that showed that about 40% of their cases were from asymptomatic transmission. Another study looked at, I think, a cruise from Antarctica where 80% were asymptomatic. Again, you're going to see variation, but the take-home message for viewers is that people are spreading this virus without knowing it. They might feel totally fine, but they're out in the community, they're not wearing a mask, maybe not washing hands, they're in close contact with other people, and they're inadvertently infecting other people. And these same people could get sick, could go to the hospital, and unfortunately may even die. And I'm especially worried about older people, grandparents, uncles, aunts that are older in homes, at home. I'm also thinking of people who are immunocompromised, maybe getting chemotherapy, and I'm thinking of other people with chronic conditions. So this is why this asymptomatic spread is important, and we need to be able to minimize the transmission.
Dr. Roy, the asymptomatic patients were also more likely to be women. Is there a reason why that would be?
Yeah, so the short answer is I have no clue. We have no.
Thank you for your honesty.
Yeah, well, I think it's important to have transparency, and I think that's how you get credibility. When the medical and public health professions say, look, we don't know, well, we're going to find out. We're doing research to find out. There may be no connection. You need a lot more data to understand exactly what's going on here.
Yeah, good to know. Thank you. And hey, even if we don't know now, it is good to know it's something we are looking at, and we'll hopefully get those answers. Dr. Roy, thank you so much.
Great to be with you, Allison. Have a great day.
You too. It has killed children on both sides of the Atlantic, a mysterious multi-system inflammatory syndrome that's been linked to the coronavirus. A British doctor was one of the first to flag this illness, and now he's giving NBC News an exclusive look inside his lab in London, where a 30-person research team is learning more about the infection and its blood markers. NBC News global correspondent Willem Marks joining me now from London. And Willem, you got access to that lab. What are they learning there about this illness?
Well, this is something that's only emerged, Alison, over the past few weeks, really. It was only in mid-April, really, that they started to flag it to authorities here in the UK. We've only really in the last couple of weeks had the CDC and the WHO weighing in about the details of this syndrome. But the team in Imperial College Laboratories behind me over the past few days have been looking at hundreds of cases of this recently emerged syndrome, and then hundreds of other cases of pre-existing conditions that were around before the pandemic, things like Kawasaki disease. And they've finally, in the last couple of days, confirmed that this is a unique syndrome. It may have many of the same symptoms for the patients that suffer from it, but it is unique. And that really matters, according to Dr. Elizabeth Whitaker, one of the people involved in this research, who works at a hospital just a few hundred yards away that's associated with this research facility, St. Mary's. Take a listen.
As a clinician, what we do is we see a patient and we look at all the signs that they have, which are we examine them, we listen to the heart, and then we look at all the test results in the laboratory. And now we're able to put those together and say, aha, this pattern really fits with this emerging inflammatory condition that we're so worried about that's associated with this pandemic. And it means that we can say, well, this child may become seriously unwell, so we should give them the right treatment and make sure they've got the right supportive care in place to ensure that they don't have a poor outcome.
And the key there, Alison, is identification, is making sure early on they know exactly what they're dealing with, and at that point they can move to try and treat it.
Yeah, let's talk about treatment here. Are doctors closer to pinpointing what might be working here?
Yeah, well, what they've done over the last few weeks, and again, this is all moving very, very rapidly. There's unprecedented collaboration across the world between the doctors treating this, is looking at treatments they've already used for similar conditions, similar diseases like that one I already mentioned, Kawasaki. That includes things like essentially introducing natural antibodies into the bloodstream. It includes using, in the worst case scenarios, synthetic biological agents, and really often using steroids as well to try and bring down the inflammation that so often is a consequence of this syndrome. Those have all worked in the past. They seem to be working effectively at the moment, but the doctors I've been speaking to, Alison, saying these are not necessarily the best possible treatments. They're just the ones they know about right now that seem to be working.
Willem, I know you also spoke with a mother whose daughter was in the hospital with this illness. What did she tell you?
She had a very difficult time. This lady called Shannon Fernandez, her husband Alex, they live a few hours north of London. Their 4-year-old daughter, Taya, she started to develop symptoms a few weeks after her mother had tested positive for COVID-19 and then recovered. Those symptoms to begin with were just really quite severe stomach pain. Initially, doctors said they thought it was constipation. They were consulting the parents by telephone, and on 2 occasions they said, just give her regular pain medication, she'll get over it. After a few days of that, she didn't seem to recover. She had a high fever as well as these severe stomach pains, and her mother insisted on taking her to the ER. Once she arrived there, they again said, this looks like it could just be constipation. One doctor said, you know what, let's take blood tests because this doesn't make sense to me. These symptoms aren't very logical. There's not a pattern I recognize here. And the second of those blood tests came back with these incredibly high infection markers, typically an indication of a bacterial infection, these particular markers. And they started trying to treat it with antibiotics. Now, that was not the right course of action, but they didn't know any better. It was only once specialists got involved, they figured out it was this new syndrome that they'd been hearing about over the past few weeks, at which point they started to treat it. I talked to Shannon Fernandez, her mother, about the challenges this entire situation presented to the family.
And when she was put on all the treatment, the nurse stayed in basically all night to keep an eye on her. That's when I got more scared, because I didn't know what the outcome was going to be, and nobody could tell me. Every day was, we have to take a day at a time. Even if it's not a day, take an hour at a time. That frightened me the most.
And the challenge here, of course, is you've got hundreds of kids presenting with these unusual symptoms taken together, and obviously doctors who haven't come across them before wondering how exactly they should be treating it. There is now more information being sent out in the form of alerts to pediatricians all over the world, and they're getting in touch with teams like the one here researching this, trying to find out exactly what will be an accurate diagnostic test when it comes to blood tests. And that, again, is all about identification early. All of the doctors, all the scientists we've been speaking to saying that identification early is key. But also, if any children do express or indicate they have symptoms like these, the best course of action, Alison, is to go and speak to a doctor as soon as possible.
Willa Marks in London, thank you so much.
Thanks.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.